Okay, Assalamualaikum and good day. Alhamdulillahi Rabbil Alamin. Allahumma salli ala Muhammad wa ala ali Muhammad. This video will be the first part of my lecture on occurrence management. Okay, so let's start with understanding what occurrence management is. So occurrence management is a process of dealing with events that have negative impact on an organization. So what are the events that can have negative impact on a diagnostic laboratory? There are a lot of possibilities, okay? They include samples not being processed correctly, samples going missing, samples that were not processed in time, or samples that had their results sent later than they should. Okay, so those are events that can negatively impact a diagnostic laboratory in different ways. Right. So because of that, occurrence management play an important role in ensuring that the laboratory service provided by the lab remains good. So if a laboratory can ensure that occurrence management is carried out effectively, that would mean that the risk of negative incidents or events occurring would be lowered or minimized. Okay, and this is very important because the diagnostic laboratory in hospital plays a crucial role in healthcare. If you think about the various kind of services that a patient, whether outpatient or inpatient, receives in a hospital, it's highly likely that a diagnostic laboratory is somehow involved in the healthcare treatment, and they could be in the form of processing of blood samples, tissue samples, and so on. So if something negative like a sample being processed incorrectly, such as an antimicrobial test that was not performed correctly, which led to misidentification of a pathogen, you can imagine that that would then lead to the wrong treatment, and that could also mean a patient being harmed because the patient received incorrect medication, the medication that was not effective, and in a worst case scenario, the patient could die. Okay, so occurrence management is really central to a diagnostic laboratory being effective. Okay, so in occurrence management, right, you have errors and near misses identified and handled. Okay, so later I will try to explain what do we mean by errors as well as near misses. Okay, so what are laboratory errors in the first place? Okay, if we look at the literature, errors can be defined in various ways. Okay, but basically an error is something that happens when you plan for something, but when you do it, it doesn't actually go according to plan. Similarly, an error could also be constructing or formulating a plan, but the plan was not suitable for whatever that you're trying to do. Okay, maybe my words are not the best, okay, in describing the definition of errors. So if you have time, I suggest you try to look up, okay, what error is, okay, by definition in proper words. All right, but in any definition, okay, I think it's clear that errors are something that we do not want to happen, okay. And the reason why we do not want them to happen is because usually when errors occur, we can see that there will be some negative consequences, okay. In the case of a diagnostic laboratory, that would involve things like samples need to be processed again, or patient being classified, incorrectly, okay. Okay, so other examples of negative impacts include waste of time, resources, and other issues. Okay, I remember attending a seminar at IIUMMC that raised the issue of increasing costs borne by laboratory processes that was due to samples not being sent in the proper package, okay, in their proper containers. So you have things like samples being sent in plastic bags that somehow leak, and as a result you have feces contaminating the urine in the same plastic bag that was supposed to contain two separate and isolated containers. Okay, so these are examples of errors, okay, not necessarily inside the lab, okay, but like I said before, errors are something that we want to prevent and minimize, okay. So what about near misses? Near misses, on the other hand, is actually when an error occurs but it does not actually cause any impact, and that's because often the error is detected quite early on. As a result, something was done in order to prevent the error from harming anyone. Okay, with that out of the way, let's look at why do laboratory errors occur. Okay, but before I answer this question, think about the perception about errors. Okay, many people mistakenly believe that errors are caused by workers who are not competent. Okay, so when I did my PhD, I was doing my studies on medical errors. So medical errors involve errors committed by various healthcare workers, okay, in the healthcare system. The one perception that some people have is that as doctors, as scientists, as nurses, as pharmacists, they are supposed to be well trained and competent, so much so that they should not be making mistakes. All right, but in reality, that is a false understanding or mistaken understanding of how errors work. The reality is that any one of us can commit error at any point of our career or our daily lives. Okay, to put things into perspective, okay, imagine you're leaving your room, okay, for work or for your classes, okay. Has there been any point in the past that when you did that, you actually left something very important? It could be your keys, it could be your wallet, all right. So I'm sure we all have done something like that, all right. Despite that task being, leaving your room with everything essential with you. I'm sure, despite being a very simple task, there might be one in 1,000 attempts we have actually made an error. We forgot something. Okay, in my case, I forgotten my keys. Sometimes, in the past, I forgotten my wallet. All right. So those are simple tasks. So imagine the tasks that are carried out in hospitals. All right. So when we talk about errors, okay, we shouldn't imagine somebody in the healthcare system who is doing mistakes 24/7, meaning every day, all the time. If that happens, then yes, I think that's a competency issue. Okay. But if for everyday, just for normal people, all right, out of 10 out of the days you work in, let's say for 10 years in hospital, I can confidently say that you will make a mistake, at one point in those 10 years. The question is, in occurrence management, is not how do we ensure that you don't make a mistake. The question is, how do we ensure that when you do and you will make a mistake, how can we prevent those mistakes from harming anyone? Okay. Unfortunately, this topic is actually quite large, and I don't think I should go into detail about it. Okay, so I'll try to just briefly explain, okay, some concepts about it. Anyway, back to why do laboratory errors occur? Okay, so plenty of reasons. Okay, number one, miscommunication. Number two, poor training, not following protocols, and etc. Okay, so you can see here there are a number of different reasons why laboratory errors occur, and these are listed in the reference that I think Dr. Narasida has informed you already. Okay, etc. here is an understatement. Okay, there are just so many reasons why laboratory errors occur. But what I would like to add here is that there is no single cause of a laboratory error incident. Okay, often a lot of factors are involved when something goes wrong. For that reason, it's really crucial that when an error occurs and there's a investigation about why the error happened, okay, that whoever is investigating should not look for one single cause, and definitely should not blame the worker immediately. That is counterproductive to the investigation. Okay, so like I said before, this etc. here actually signifies a whole lot more of reasons why laboratory errors can occur. Okay, now let's look at some of the examples of errors that occur at 3 different phases of the laboratory process. Okay, so we have the pre-analytical, analytical, and post-analytical. Okay, that's one way of describing the 3 phases of processing a sample in the diagnostic laboratory. Over here though, in the reference, they use the terms pre-examination, I believe examination, and post-examination. Okay, so for pre-examination, okay, some of the errors that can occur include collecting the wrong sample. Okay, collecting the wrong sample, mislabeling or failing to label the sample. Okay, storing the sample incorrectly prior to testing. Okay, so prior to testing is a very important phrase here, because this actually is a common trait for all pre-examination errors. Okay, they all happen before the actual testing. Okay, so other examples include transporting the sample under conditions that damage the sample. So what I said just now about what I've heard during a seminar in IIUMMC, okay, is similar to this example here. Okay, so you have samples that are damaged because they were not transported in a proper way. So imagine if you're a patient and you've just underwent a painful process of providing sample. Maybe, you know, they had to draw blood, or maybe in worst case get your CSF fluid. Imagine if they come back to you later in the same day or the next, and they said we need to get this the sample again. Okay, we need to get more sample because the sample that we collected before was damaged, okay, on the way to the lab. So that does not look good to the organization, and that does not help the patient in any way. It's a waste, it's painful. Okay, so errors, even errors that occur before the tests are carried out, can be detrimental to everyone. Okay, and the final example given here is damaging the reagents or test kits by storing them improperly. Okay, next we have examination errors or analytical errors. So these are errors that occur during the testing process. Okay, so the testing process, all right. So they include failing to follow an established algorithm, for example, for HIV testing, reporting of results when the quality control material tests out of range. Okay, so this is something that should be done periodically or constantly, and that's because to ensure that whatever results that we obtain during the examination or analysis process is valid. Okay, incorrect measurement of the sample or reagents, okay, due to dilution of or pipetting errors, using reagents that have been improperly stored or after their expiration date. Okay. Okay, the third phase, the post-examination errors. Okay, these are errors that occur after the examination or analytical process. Okay, so the reference says that some of these may be difficult to detect, and that's true because if you look at the type of errors that occur in this phase, they are not very obvious. Okay, so examples of post-examination errors include making a transcription error when preparing the report. Okay, so you have the results and then you have to transcribe, okay, the findings in the report. Okay, so imagine if you mistakenly write, okay, something, maybe you switch some numbers, instead of 542 you only write 54. Big difference. Okay, big difference. And the thing is, it's very difficult to detect that unless someone knows that the value is off, or someone actually compared the transcribed information in the report with the results. Okay, so those take time. Okay, and that's one of the reason why it can be difficult to identify and detect post-examination errors. Okay, other examples include sending the report to the wrong location, failing to send the report. Okay, that sometimes happen. Sometimes for whatever reason, maybe there's a huge number of reports that need to be sent out, and one of them was left out during the delivery. Okay, so that's a big problem too. Okay. So what are the impact of laboratory errors? Okay, so firstly, you have patient care being compromised. So we know that if you work in a hospital, your number one priority is the patient. Simple as that. Okay, so whenever laboratory errors occur, there is a very big chance that the healthcare that patients receive will be affected. As a result, the patient may be harmed because of the laboratory error. So it's really important to remember that if you end up being a biomedical scientist in hospital, that you must realize you have a central role in the healthcare system. Okay, no matter what disease or illness is afflicting a patient or any patient in the hospital, okay, it's highly likely that that patient is depending on the analysis that you carry out in the lab. Okay, not just the patient, okay, the doctor, the nurse, and the other clinicians, because they will make decisions. Well, specifically, well, primarily the doctor. Okay, they will make decisions based on the laboratory findings. So if someone screwed up, if someone makes a mistake or an error, then the doctor may not realize that their decision is based on an incorrect, inaccurate information. Okay, all right. So patient harm. Okay, two ways of looking at it. One is you have patient actually being harmed because of laboratory errors. The other is you have the patient not being harmed. It's just that you have to do the sampling again. You have to run the samples in the lab again. So that means that the patient has to stay in the hospital far more longer. Okay, and the patient has to, you know, undergo the sample collection again. Okay, and so on. Meaning that there may be a possibility the patient has to pay for the additional processing if things are not ethical. Okay, so lots of things can go on because of laboratory errors. All right, then there's inappropriate public health action. These could be actions that are intended to improve the outcome of the public health. Okay, so the health of the public, of the community, but unfortunately, because those actions are based on a faulty laboratory process, then the decisions that were made may not be best or correct. Right. The other thing is undetected disease outbreaks. So coincidentally, we are in this COVID-19 pandemic. I'm sure you may have heard of testings of people under investigation for COVID infection. So there has been cases in certain parts of the world. I'm not referring to Malaysia. Okay, though I cannot say for certain whether this happened in Malaysia as well or not. All right, but there have been reports that people who undergo COVID-19 testing did not get accurate results. Okay, whether it's because of the test themselves or maybe because of the mistakes or errors that have occurred during the testing phase. Okay, so if an error occurred in such situations, you imagine a person being told that he or she has COVID-19 when in reality he or she is healthy. Okay, so on the other hand, you could also have people who have COVID-19 but being told they are free from COVID-19. So as a result, you know, that person will be going to the community you know, in a very, how you say, not so fearful about spreading disease, because he or she is confident that, you know, there's proof that he or she does not have COVID-19. Okay, so that can be disastrous, okay, in terms of controlling the spread of diseases. Okay, and then there's wastage of resources. Okay, it's a waste of money to actually repeat tests. Okay, the image of an organization will be tarnished. Okay, if a hospital messed up laboratory your laboratory results, there's a chance that you will not go to the hospital again, or even if you did, when someone asks about your experience, you may talk back things about the hospital, okay, giving your views about your experience.